Excellent. Thanks, Sharon. So good morning, everybody. Thanks for joining us for our nationwide AI collaborative meeting. So over the past few years, I think even just hearing the discussions today, right, we're witnessing the acceleration of AI adoption within healthcare, right? We're seeing applications from clinical decision support, operational or administration, automation, image analysis, patient engagement tools. Really, that integration is happening now. This technology is becoming more accessible within healthcare today. But with this rapid adoption that we're seeing, there's still many questions about safety, appropriate usage, operational feasibility, transparency, effectiveness, or impact of these types of technologies, right? So how do we ensure that our AI technology improves patient outcomes, improves our hospital operations rather than perpetuate any types of existing or new risks or biases in our organizations? How do we establish trust, safe usage amongst our patients' providers? How do we create standards that promote innovation while ensuring responsible usage of these applications? And so our panel here today is actually a wonderful collection that are driving two very key initiatives to address these challenges. First, there's the Coalition for Health AI, or often called CHAI. The second is a Trustworthy Responsible AI Network, or called TRAIN. Largely, when you hear about these two groups, CHAI is focused on, I'd say largely, developing guidelines and standards for responsible AI, or what we call the what around responsible AI, while TRAIN is really concentrated on how do we operationalize these principles, or the how of our implementation. So I'm very excited to have our panel here today. I'll come over, I'll introduce our panel members, and we'll kick off a conversation with them. Excellent. So thanks for joining, everybody. So maybe I can just go across and have everybody just do a quick introduction of themselves, if you wouldn't mind. I'll start with you, Brian.
Absolutely. So really excited to be here. Thanks for having me. Brian Anderson, President and CEO for Coalition for Health AI, physician data scientist by training.
Yeah, hi, Eric Peterson, Vice Provost for Clinical Research at UT Southwestern.
Peter Emby, I met you all earlier today from Vanderbilt University Medical Center.
Hi, Ryan Rosenzweig, Director of Health Alliance Innovation at Microsoft.
Excellent. So thanks for joining us today. I think what would help us all sort of level set with the audience is let's talk a little bit about our organizations, the CHAI and TRAIN, and what they do. So maybe, Brian, I could start with you and help the team understand what CHAI is working on.
Yeah, so we're more than just a spiced tea. CHAI was started about 5 years ago in the middle of the pandemic when organizations were coming together looking to solve this big challenging problem that we had in the pandemic. What we quickly realized was inherently competitive groups that work together collaboratively can do a lot and have tremendous impact. We quickly asked ourselves, there's something more that we can be doing beyond the pandemic. We looked at AI, and one of the first questions we asked was, do we have consensus at a technically specific level to the point of these standards that you mentioned to inform what responsible AI looks like across the different tech companies that were part of CHAI, across the different health systems that are part of CHAI? The answer we quickly came to was we don't. We don't have that level of granular specificity that says this is what responsible AI looks like for a software developer, for a health system or a payer implementing it, for an AI governance platform monitoring it and managing it. And so that's really been our North Star, is building those consensus best practice frameworks and standards, and then importantly, enabling the independent evaluation and monitoring of those models, really to build that kind of trust that I think we all want to see and unlock in the consequential use cases in health.
So very, very important initiatives. And then we pass it off to TRAIN around the how, and just call it, so Eric, Peter, Ryan are co-founders of the TRAIN initiative. So I'll send it to the panel to give us some discussion about what TRAIN is about.
No, is this on? Yeah. So, oh, there it is. All right. Yeah, thank you very much. Kind of as you alluded to at the top, a lot of us have been involved also with CHAI, and so working across the different health systems, one of the things that, and working with Microsoft, one of the things that we realized a couple of years ago was that, exactly as Brian was saying, such incredible work happening at the level of CHAI, and those of us that day to day are working at the level of health systems trying to operationalize and run governance, actually make decisions about procurement and deployment, and then actually do the work on the front lines, recognized that we were all struggling a bit with kind of how to do that. Even as we were contributing to and learning from and benefiting from the principles and the guidelines and all that were coming out of the work at CHI, translating those into how we actually operationalize those in the real world was something that we were all trying to do, and we realized we were all doing it individually, and we could benefit from connecting to one another in a different forum that would allow us to start with what really got the groups, we're up to about a little over 50 health systems now, together to share first best practices or emerging practices around how do you actually do the work of operationalizing AI at the level of a health system. And then pretty quickly kind of evolved into the focus on the technology-enabled approaches to governance from the perspective of everything from initial adjudication around what we're going to procure, to the validation steps that need to be taken, to the actual determinations around ROI and safety and efficacy, and then of course, as you heard me talk about earlier, to monitoring. And from that, we've been kind of evolving across the members who were kind of in a convergent evolution sort of fashion, individually kind of developing different approaches to these things, where there's now increasingly some sort of emerging technologies, some at the level of the vendors, some at the level of the health systems that are now can be shared across the network. And that's really been the evolutionary step. So I think in a lot of ways, we've always seen and continue to see the complementarity between CHI's role and Train's role. And in fact, we wrote a paper earlier this year that we published in JAMA about Train that actually kind of organized the representation that way to sort of show the relationship for the various kinds of organizations that are evolving. I'll also take a moment to say that one of the people not on the dais here, there's a couple of people that have been really active in this. Michael Pensina, our colleague from Duke, and David Rue, the global CMO from Microsoft, of course, colleague of Ryan's, and actually, because he's a global CMO, has also been kind of evangelizing this across the globe. And we've got a Train group in Europe. I call them Eurotrain. They don't like that, but it makes sense to me. And then, no, joking, they're fantastic, but very different, some similarities and some differences. So very interesting to see what's happening nationally here, but also what's happening globally. And we've had additional interest, I'm sure Brian can speak to that also from the CHI perspective, on people that are grappling with this all over the globe. So interesting.
Let me just amplify, I think, something, Sean, that you said at the top that Peter's also alluding to, which is CHI is bringing together, now we have over 3,000 organizations to develop consensus best practices. I would call that the what, kind of the North Star. What CHI will never do is get into the competitive, space of building IP or the how, the tools, right? Where organizations just like Train can come together to build those tools on Azure, or if there's another hyperscaler that wants to start an organization, they can do that too. So it's really exciting to take the standards and the frameworks and actually bring that down to where the rubber meets the road, and building the kind of tools that Peter is building with Vamos, or that Microsoft is building with Fabric, and what everything that we're seeing here with University of Texas Health. I'm really proud that we have 3 founding members of CHI and 3 founding members of Train here together.
Excellent, thank you. So maybe what we'll do is invite folks that would like to ask questions. Please step up to the microphones if you would like. In the interim, a question for Eric. Working at UT Southwest, working through clinical validation approaches, how are you seeing CHI and these Train initiatives help accelerate taking algorithms that you might be building internally, getting them validated, and getting them into workflows, whether they're clinical or operational workflows?
Yeah, I think Peter did a very good job, both in his opening speech, giving us an idea about the reasons for this. We're all struggling, keeping up with where technology is going, the numbers of vendors out there, the opportunities. There's a ton of potential cases, but how safe, effective, impactful will these be? The ability to share and learn from your peers, like that's what we're all needing. It's not, it's actually in our own self-interest to share in this case, because truthfully, any one center, no matter how important or big or pristine their data is, they won't know how the other centers are doing or what they're using or how valid the tools they are until and unless they sort of share in these larger cooperatives. So, you know, my hat's off to Peter and also to Brian and others who've sort of started these programs that will help establish the national precedent for this activities.
Thanks, everybody.